Obsessive compulsive disorder is a potentially disabling illness that traps people in endless cycles of repetitive thoughts and behaviors. People with OCD are plagued by recurring distressful thoughts, fears, images they cannot control. The anxiety or nervousness produced by these thoughts lead to an urgent need to perform certain rituals or routines, also called compulsions. A person with OCD may or may not realize that their obsessions and compulsions are excessive or unreasonable. Obsessions and compulsions are significantly time-consuming and interfere with daily routines, social life, or work functioning. Obsessive-compulsive disorder deals specifically with routines and compulsions that take up to hours of a person's life. To be diagnosed by a doctor with the disorder, one must take 3 different tests given by a doctor, including a physical exam, lab test, psychological evaluation. A person with obsessive-compulsive disorder will start showing signs at a stage in early childhood. Symptoms, if not treated early, will continue to get worse throughout adulthood. Obsessions are not something a person can control. They are ideas or feelings in the mind of a person and are capable of taking control of that person's body. Common obsession symptoms include fear of dirt or contamination by germs, fear of causing harm to another, fear of making a mistake, fear of being embarrassed or behaving in a socially unacceptable manner, fear of thinking evil or sinful thoughts, need for order, symmetry, or exactness, excessive doubt, and the need for constant reassurance. Compulsions, on the other hand, are an irresistible urge, especially one that is against one's conscious wishes. Compulsions tend to behave like behaviors, but can also be thoughts, such as counting. Although compulsions and obsessions are somewhat similar, they differ in distinct ways. Common compulsions one with OCD might have include repeated bathing, showering or washing hands, refusing to shake hands or touch doorknobs, repeated checking of things such as locks or stoves, constant counting mentally or aloud while performing routine tasks, constantly arranging things in a certain way, eating foods in a specific order, being stuck on words, images, or thoughts, usually disturbing, that won't go away and can interfere with sleep, repeating specific words or phrases and prayers, needing to perform tasks a certain number of times collectively, and hoarding items with no apparent value. Obsessive-compulsive disorder treatment may not result in a cure, but it can help you bring symptoms under control so the OCD doesn't rule your daily life. A person with this type of anxiety disorder can be very treatment resistant, typically because they do not perceive themselves as having a problem. Treatment include cognitive behavior therapy, CBT, which is the most effective treatment for OCD. It's the effective types of CBT are psychotherapy and exposure and response prevention, or ERP, which has the strongest evidence supporting its use in the treatment of OCD. Exposure and response is a type of therapy that involves gradually exposing you to a feared object or obsession such as dirt and having you learn healthy ways to cope with your anxiety. Psychosurgery, which is used to alleviate symptoms of obsessive-compulsive disorder in patients who do not respond to medications or behavioral therapy. Electroshock therapy has a bad reputation that people think has negative effects, but it doesn't. And during ECT, the psychiatrist uses a machine to deliver transcriminal magnetic stimulation utilizing magnetic fields to stimulate the nerve cells in a patient's brain. The shock triggers are a controlled seizure to activate neurons that bring out changes in neurochemical levels in the brain. Although OCD takes away a lot of people's lives, there are treatments and there are ways to get past it. Obsessive compulsive disorder is treatable and it can be cured. Obsessive